Good morning, everyone. I want to welcome you to this webinar entitled Impact of Global Economic Consequences Resulting from COVID-19 on Drug Policies, organized in partnership with the Pompidou Group and CICAD OAS. My name is Pamela Westphal from the Institutional Strengthening Unit of the Executive Secretariat of CICAD OAS. Before starting this virtual session, I would like to inform you of some in-house logistics. This virtual forum will have simultaneous interpretation in English and in Spanish. You can configure the language of your preference by turning on the interpretation service, pressing the interpretation icon in the menu below. In case you lose your connection, I invite you to use the same link with which you access the webinar in the first place. As part of the opening ceremony, we have the honor of having the presence of Ambassador Adam Nam, Executive Secretary of the Inter-American Drug Abuse Control Commission of the Organization of American States, and of Mr. Dennis Huber, Executive Secretary of the Pompidou Group, Council of Europe. After the opening remarks, we will proceed with a brief introduction on the subject that we are today discussing, followed by an intervention of a select panel of distinguished authorities. Without further ado, I give the floor to Ambassador Adam Nam, Executive Secretary of CICAD OAS. Ambassador, the floor is yours.
Thank you very much, Pamela. Good morning or good afternoon. Greetings to everybody from Washington, D.C. And I hope that wherever you are, you, your family, and your colleagues are all well. On behalf of the Executive Secretariat of the Inter-American Drug Abuse Control Commission, known by its Spanish language acronym CICAD, it is a great honor to speak at the opening of this important event, organized in partnership with the Pompidou Group, on how COVID's economic consequences are affecting drug policy. I am so pleased that CICAD enjoys a wonderful partnership, an even stronger partnership now than ever with the Pompidou Group. And I send warm greetings to the Pompidou Group's Executive Secretary, Denis Hubert, as well as Thomas Katau, Elena Hidu, and other contacts in that organization. Now to the topic at hand, COVID's economic consequences and their impact on drug policies and programs. It goes without saying that governments worldwide are under tremendous financial pressure because of the pandemic. The restrictions on movement imposed to slow its spread have drastically slowed economic activity, and of course the economic damage is already evident. The World Bank predicts that the global economy will shrink by 5.2% this year. If so, that will represent the largest economic shock the world has experienced since World War II. The pandemic has hit Latin America and the Caribbean later than other regions, but it has had a profound effect there, due in part to weak social safety nets, fragmented health systems, and deep social inequalities. As a result, the economic outlook is worse for this region than for the world as a whole. The United Nations projects that, taken together, the economies of Latin America and the Caribbean will contract by 9.1% in 2020, the worst recession in a century. The economic effects on the US and Canada have also been severe. Obviously, this devastating economic impact will affect OAS member states' abilities to address the drug problem. The almost certain reduction in funding for programs such as drug prevention, treatment, and social integration services, not to mention the difficulty of providing and accessing these services due to curtailed in-person contact, present a daunting challenge. A recent CICAD survey of OAS member states shows that most countries believe drug consumption and dependence is on the increase due to social isolation. Moreover, changes in drug use usually follow changes in economic conditions. Research tells us that when a population, whether it is in a city neighborhood, an ethnic group, or any other group of people, is left behind economically, it is more vulnerable to drug use. The loss of employment and income, or even just the experience of dropping into a lower income bracket, bring the loss of social trust, increases in stress, mental health issues, and other problems that firmly established risk factors for increased substance use. We already know that these risk factors are on the rise. The same studies that examine drug use during confinement point to an increase in stress, anxiety, financial concerns, unemployment, sleep loss, and more. In other words, the pandemic's economic impact has set the table for a surge in drug use. That surge, coupled with the reduction in drug treatment services, is an unfortunate and perilous combination. CCAD also conducted a survey of OAS member states on how narco-trafficking has been affected by the pandemic. The responses indicate that, not surprisingly, criminal drug traffickers are taking advantage of current national and global vulnerabilities. Although some trafficking has been disrupted by the pandemic, drug control authorities are experiencing significant difficulties in performing their duties because a sizable amount of their personnel and financial resources have been reallocated to security and humanitarian tasks related to the pandemic. I hope this webinar will help all of us find answers to these challenges, as well as strengthen cooperative efforts between participants, countries, and regional bodies. Let me finish by thanking you again for joining us in this virtual space. Your presence demonstrates your commitment to effective drug policy and to helping people in need. I wish you all the best, and again recognize and thank the Pompidou Group for its joint hosting of this webinar. Thanks very much.
Thank you so much, Ambassador Nam. I now give the floor to Mr. Dennis Huber, Executive Secretary of Pompidou Group, Council of Europe. Dennis, the floor is yours.
Thank you, Pamela, and thank you to Ambassador Nam for his nice words of introduction. Indeed, it's an honor and a pleasure to be here and share my opening remarks with you. It's such an honor and a pleasure that I'm doing it, even being on holidays. This is why you can see that my dressing is not as official as usual. I want to stress also, like Ambassador Nan did, the importance that we attach the Pompidou Group to our cooperation with the CCAD from the OAS, and indeed this cooperation has really been growing quite a lot over the last years, especially after Mexico joined the Pompidou Group in 2017, and also after the first joint activity that we had almost 1 year ago in Iceland. It was a fascinating seminar on the Icelandic model of preventing young people of using drugs, and all of those who were there keep a very good memory. By the way, I think that it's very good for us to have Minister Jonasson with us today, because this will be a kind of bridge between our first joint activity last year and this one, which is in fact the second joint activity, not as we thought as it would be last year. I think none of us would thought at that time that it would be a webinar, and especially not under those circumstances. But this being said, I think it's important that we continue to strengthen our cooperation, and I want also to stress that this cooperation is taking place within a wider framework of a memorandum of understanding, which has been signed back in 2011 between the Council of Europe and the Organization of American States. And by the way, in this memorandum, it was specified already at that time that drug policies, drug issues should be one of the priorities of this cooperation between our two organizations. Ambassador Nan has very, I think, precisely and rightly set up the picture of what we are facing today. We are facing the most difficult economic crisis perhaps ever, at least since the last World War. And this, of course, has deep consequences to all sectors of life, including for people who are using drugs. This is the reason why the Pompidou Group has set up in April 2020 a platform where everybody, NGOs, individuals, doctors, or drug users or their families can share their experiences and also address the solutions that have been found. So it's a very practical tool to see exactly what has been happening on the ground, what experiences did people live, and also what sometimes very pragmatic solutions were found. And this platform is of course accessible for those who are interested in, and it is open to 6 languages. We have broadened our normal scope of languages, which is only French and English in the Pompidou Group, but we felt that if we want really to give the floor to the people who are acting on the ground, we need to have more languages. I want just to finish by saying that something very important has happened today in the early morning in Europe. It is the decision taken by the heads of states and government of the European Union in Brussels after 5 days of very long and difficult negotiations, and the fact that we now have this package of 750 billion euros which will be put at the disposal of the member states of the European Union to put in place recovery of their economy after the crisis, or not after the crisis is still there, of course, is a very big step forward, and it allows us to look a little bit more optimistically into the future. And I hope that this will materialize, that we will get out of this crisis. But anyway, we will have ample time to discuss that over the next 2 years. Thank you very much.
Thank you so much, Mr. Dennis Huber, for those very remarkable words. Moving on to the introduction session, it is my pleasure to present Angela Crowdy, Assistant Executive Secretary of CICAD OAS, who will provide us with some background context for this webinar. Angela, the floor is yours.
Thank you, Pam. Good morning, everyone. May I first thank Ambassador Adnan and Mr. Denis Hubert for their opening remarks. I would also like to extend a warm welcome to all the panelists and to everyone joining us here today. The COVID-19 pandemic, as the defining global health crisis of our time, is the greatest global challenge we have encountered in the last decades. Governments are operating in a context of much uncertainty and are facing difficult trade-offs given the health, economic, and social threats posed by this virus. We are seeing the severe impact of this pandemic in our hemisphere, with significant consequences in all OAS member states. Although each country is unique, many are experiencing the same adverse effects. Therefore, the crisis management and policy responses of our states must move in the same direction. We understand that the priority for governments is to reduce as much as possible COVID-19's impact on our communities and flatten the curve of infections and death. Healthcare systems and social programs are overwhelmed and strained, particularly affecting individuals with problematic drug use. A failure to support and efficiently and effectively treat these individuals will have dire consequences on themselves, their families, and societies in the long run. The lack of access to treatment, along with the suspension of social integration programs and other crucial services, can lead to increasing drug consumption, drug relapse, and other drug-related issues such as interpersonal violence and mental health issues. It is important to evaluate the consequences of the economic downturn, the magnitude of its impact on drug policies, and the policy responses. Since the beginning of this pandemic, CCAD's Executive Secretariat has continued to support OAS member states by providing specific technical assistance, developing recommendations, and organizing virtual meetings with key experts, among other activities, all in a bid to respond to the rapidly evolving challenges brought about by the pandemic. During this time, national drug policies remain the key instrument to respond to the world drug problem, intrinsically linked to national drug authorities and councils, to their capacities, to their adaptability, and their experience. At the same time, all stakeholders are responsible for implementing the actions set forth by these policies and for strengthening institutional cooperation to ensure effective and coordinated drug responses. At CCAD, we understand that an effective institutional response to the world drug problem relies on the capacity of national drug authorities and councils, together with other national and local actors, to maintain a balanced approach between demand and supply strategies. Their ability to coordinate those strategies, together with a robust national drug policy that defines strategies, lines of action, and specific interventions, are key to reducing drug abuse and drug-related consequences. Lastly, on Friday last, during the opening remarks of CCAD's 67th virtual regular session, the OAS Secretary for Multidimensional Security, Farah Urrutia, highlighted the importance of continuing to join forces with strategic partners and of strengthening our synergies and collaborative ties with other institutions to achieve sustainable, evidence-based results with respect for human rights, gender equality, and fundamental freedoms for all. May I close by reiterating the importance of developing and strengthening institutional international cooperation during these difficult times as we consider the impact of global economic consequences resulting from COVID-19 in our efforts to combat the world drug problem in the hemisphere. Thank you very much.
Thank you, Angela. I now give the floor to Elena Edo, Senior Program Officer of the Pompidou Group, Council of Europe. Elena, the floor is yours.
Good afternoon, everyone. Good morning. It's also my pleasure and honor to be part of the first joint webinar we're organizing with CCAD. So what brings us here today is the concern how the economic consequences of the COVID-19 pandemic will impact on governments' ability to deal with drug problems. Already now, we experience the effects of unprecedented global economic downturn as a result of the pandemic. It is widely acknowledged that economic crisis affects all determinants of health, housing, education, and employment. Furthermore, it increases existing inequalities and hits the most vulnerable and the hardest. Very often, budget cuts and austerity measures aggravate the situation. During the 2008 financial crisis, we in Europe recorded some significant developments in the sphere of drug policy. Firstly, significant increases in binge drinking and problem drug use. Secondly, a widespread use of dangerous substances and unsafe use. Thirdly, an overall increase of crime and drug use related to increase of unemployment among young people. And probably most striking was the rise in HIV/AIDS infections that were recorded in countries where harm reduction programs were discontinued as a result of austerity measures. Luckily, we were able to study the effects of economic crisis and austerity measures on drug use, public health, and human rights. They should enable us to learn lessons for the future, to be better prepared. Besides learning from experience, we must recall our obligations under the Council of Europe and United Nations conventions. They require governments to protect fundamental rights and freedoms, also in times of economic crisis and budgetary constraints. It is our obligation to ensure that budget cuts and austerity will not lead to a weakening of human rights and democracy. The good news is that there are many positive and creative examples of how to deal with such challenges. And we hope that this webinar will bring some of them to light and inspire us.
Thank you so much, Elena. We will now begin the discussion panels. Therefore, it is my pleasure to introduce our moderators for today, Mr. Antonio Lomba, Chief of the Institutional Strengthening Unit of the Executive Secretariat of CICAT OES, and Ms. Elena Edo, Senior Program Officer of the Pompidou Group of the Council of Europe, who will be moderating this discussion panel. Antonio, the floor is yours.
Muchas gracias, Pamela. I'm going to turn to Spanish. Cambio de idioma. Les recuerdo que tienen interpretación en la parte inferior de la pantalla. Bueno, buenas tardes, buenos días. Antonio Lomba, voy a estar moderando con mi compañera Elena Edu estos paneles, magníficos paneles que tenemos hoy de discusión sobre tres temas que hemos identificado como relevantes y que espero que disfruten de ellos en el debate: consecuencias de la recesión económica, por un lado, el impacto en las políticas de drogas y, por último, y no menos importante, sobre todo, las respuestas necesarias para estas políticas, ¿no?, en momentos actuales. Para esta sesión tenemos el placer, la verdad es que el lujo de tener a 6 panelistas de primer nivel. Oddmundur Jónasson, que fue ministro de Islandia y es asociado honorario de la Asamblea Parlamentaria del Consejo de Europa. Bienvenido. Gabriela Torres, secretaria ejecutiva de la Secretaría de Políticas Integrales sobre Drogas de la Nación Argentina, Sedronar, conocido por Sedronar, Argentina. Bienvenida, secretaria. El señor Joan Gulao, coordinador nacional de drogas y jefe de la Dirección General de Intervención sobre Comportamientos y Dependencias Adictivas de Portugal. Bienvenido, estimado Joan. Señor Michael Tucker, que es director ejecutivo del Consejo Nacional sobre Abuso de Drogas, en CDA, también conocido en Jamaica. Bienvenido, Michael. También contamos con Gerásimos Papanastasatos, que es asesor principal de la Coordinación Nacional de Políticas de Drogas en Grecia. Bienvenido. Y por último, te contamos también, y gracias por estar con nosotros, con Luis Alfonso Bello, que es asesor regional en abuso de sustancias de la Organización Panamericana de la Salud, la OPS. Bienvenidos a todos. Y sin más demora ya entramos en los paneles. Para eso le voy a pedir a mi compañera, a Elena, que tome la palabra. Solamente recordarles a todos los panelistas que, por favor, estén dentro de los espacios de 7 minutos por intervención para que tengamos tiempo para que puedan intervenir todos ustedes. Después de esas intervenciones haremos por cada panel un bloque de preguntas individuales y también les pediría que no pasasen de los 3 minutos en sus respuestas. Elena, por favor, todo tuyo. The floor is yours.
Thank you, Antonio. So we begin with the panel on consequences of the economic recession. As the first speaker, I would like to introduce Mr. Oddmundur Jónasson. Mr. Jónasson is an Icelandic politician who was a member of the Icelandic Parliament from 1995 to 2016. He served several ministerial posts: Minister of Health, Minister of Communication, Justice and the Interior, and was the chairman of the Parliament's Constitutional and Supervisory Committee. After his term as a representative to the Parliamentary Assembly of the Council of Europe, he was made an honorary associate and represents Iceland on the European Commission Against Racism and Intolerance. At present, he is a writer and active commentator. So, Mr. Jónasson, the floor is yours.
Well, thank you very much, and thank you for inviting me to this seminar. I would like to share some thoughts with you on the consequences of a drastic economic downturn on society at large and on vulnerable groups in particular. Now, first, about the wheel that we do not need to reinvent. Of all the organizations operating in the field of drug prevention, healthcare, and law enforcement. I am best acquainted with the Pompidou Group, and a glance through its publications gives me the impression that it is all there. In the so-called Athens Declaration, which the Pompidou Group published in 2013, in the aftermath of the worldwide economic downturn, which started in 2008, there's a good summary, which, as I understand it, and I'm generalizing a bit here, there are 4 outstanding themes which are brought attention to. Now, number 1, we are urged in all our formulations to be evidence-based. In all our work, we should be evidence-based. Number 2, in order to learn from history, from experience, we must be sharing information. And here, the Pompidou Group offers a good platform. Number 3, we must take seriously our obligations we make nationally and internationally on access to health, well-being for all. In other words, commitments to human rights must be respected not only in word, but also in deed. Number 4, there is in the declaration, in the Athens Declaration, a constant reminder that we must be flexible in an ever-changing world. And this last point is, of course, obvious in the present crisis, in the COVID crisis, where health policies and economic considerations converge in one in hitherto unknown proportions. In the Athens Declaration, and I have it here with me, and I want to quote, there is an emphasis on the need for coordinated responses at national levels, and the question is opened on where executive and decision-making powers should be placed when it comes to health-related crisis coordinations. In other words, should it be Donald Trump or Fauci who is at the command? Should it be the NIH or the White House which decides? Now, and then of course I'm referring to equivalent institutions in other countries, although we may have difficulties in finding an equivalent to the personality who is at present occupying the White House. But we have presidents, we have parliaments, we have ministers on the one hand, and on the other we have professionalism. Now the answer is by no means obvious or foregone conclusion, and as I see it, this is a discussion that we need to take further in the coming years, because it's very important. It has to do with professionalism, but it also has to do with democracy. Now, my country, Iceland, went through a very drastic crisis in 2008 and the following years, after the entire banking structure fell with a domino effect throughout society. Now, to take an example which is relevant in our context, because we have to import medicines and utensils for the healthcare system, all such imports doubled in price after the crown, our currency, was devalued by 50%. And this happened at the same time that revenues of state and municipalities plummeted, unemployment rose, households got into serious difficulties, and it goes without saying that vulnerable groups became more vulnerable, because that is, of course, one of the lessons. In extreme situations, the extremes become more extreme. Now, what did we do? A combination. We had to face this with a change in the taxation system. We hired taxes on the high-income groups. We lowered taxes on the low-income groups. We also had to make some cuts in our spending. Here we tried to cut more where it didn't hurt so much, for instance, in roadworks, in investment, but tried to spare the operational costs and the running of the welfare system. But we cut there as well. And this is where we went wrong, I believe, because if you cut, however small it is, in the welfare system, in the running of the welfare system, it is inevitably going to harm the most vulnerable groups. That is absolutely inevitable. What we did, apart from this taxation policy and this policy in austerity measures, in the cuts, we try to concentrate on vulnerable groups. We tried, or we established programs to try to eradicate child abuse, violence in the home. We looked at the rights of LGBT groups, and one more thing, we were aware that of the importance of culture. We saw that supporting culture was an important countermeasure. Now, my favorite allegory, if you like, is to say that if you get into difficulties at sea, you must take to the oars together. But the precondition for doing that is, of course, being on the same boat. And that is the biggest task, the biggest mission of any government in a country which crisis, hit by crisis. Try to make society more just, more cohesive, but because a cohesive society is better equipped to deal with crisis than a society which even doesn't think of itself as being a society. Thank you.
Thank you very much, Mr. Jonasson. You rightfully said that we don't have to reinvent the wheel. We just need to be on the same boat and create cohesive societies and going in the same direction. And thank you also for making reference to the Iceland Declaration, the policy paper which was elaborated in response to the 2008 crisis. And it is called Iceland Declaration because of the biggest problems that Greece was having at that time. So this Iceland Declarations on protecting public health by ensuring essential services in drug policy under austerity budgets and its explanatory memorandum can be found on the Pompidou Group website among publications. And I'm sure that you will be able to find a lot of relevant information that are relevant to the situation today.
May I make one more point, one small point?
Yes.
Yes, just one more point on a comparison between the crisis of 2008 and the crisis we are undergoing now, the COVID crisis. There were made studies in Iceland in the period, in the time span 2000-2010. In other words, pre-crisis, crisis, and post-crisis, on the mental health and well-being of children and young people. It showed that their health, mental health, balanced state became more balanced, better during the crisis and after the crisis than it was prior or in the advent of the crisis, where we were experiencing a bubble economy, where the parents and society at large were occupied in earning money and more money from morning to night. After the family comes together, is united in the crisis, they feel better. Now the same seems to be happening here, according to surveys that have been done, although this is still emerging. But there is an exception. Those who are on the fringes, Those who are in vulnerable groups, they have it worse. And we are seeing now that people are turning, as we are loosening the controls in society, people are turning to the health centers with mental problems. This also includes children and youngsters, and people who had to have their cancer looked into or their kidney problems looked into. They are turning up now. So people in difficulties are having a harder time, society at large not.
Muchísimas gracias. Thank you so much. De este lado del Atlántico tenemos, como anunciaba, el lujo de contar como siguiente panelista en este panel a la secretaria ejecutiva de Sedronar, Gabriela Torres, que viene con un amplia experiencia en el terreno, como trabajadora social también y como gestora en políticas públicas, locales y nacionales. Amplia experiencia. Es un gusto y un lujo tener con nosotros a la secretaria que se incorporó al puesto no hace demasiado tiempo, pero que parece que lleva aquí toda la vida realmente, en la interacción que hemos tenido con ella. Licenciada secretaria ejecutiva, Gabriela Torres, el turno es suyo, por favor. Gracias y bienvenida.
Hola, bueno, buenos días para acá, para Argentina. Un placer estar compartiendo con ustedes. Por supuesto, agradecida por la invitación y estas posibilidades de vernos estando tan lejos. Son como de las pocas posibilidades o cuestiones buenas que encontramos en este tiempo. A nosotros en Argentina, así como recién decía Antonio, el gobierno argentino tiene nueva gestión desde hace 7 meses y llevamos 4 en pandemia. Con una decisión que, por supuesto, es importante para nosotros haber aprendido de lo que venía pasando en Europa. Entonces Argentina entró en una cuarentena muy temprana, desde el mes de marzo, con diferentes fases y tal. Digo esto porque nosotros en Argentina tenemos que trabajar mucho en relación a diferenciar que una cosa es la pandemia, que es una irrupción incontrolable, es una catástrofe, es mundial y tal. Y otra cosa es la decisión del Estado argentino de estar en cuarentena como una estrategia de cuidado, que en general, por supuesto, se confunde y estar aclarando. Se generó otro gran debate. Quisiera como compartirles 2 o 3 grandes tensiones, y en relación a eso algunas decisiones, por supuesto, políticas de acción. El otro, ese es uno, ¿no? Si la cuarentena es mala, digamos, como no pudiendo distinguir qué es pandemia y qué es cuarentena en tanto estrategia de cuidado que se ha usado históricamente en la humanidad para pandemias. La otra situación es el debate que en general queda falso si hubiera que elegir entre la salud y la economía. Y ese es un debate que también está como presente todo el tiempo en Argentina. Lo tercero es lo que decían, por supuesto, los que me antecedieron en relación a tener una política clara en relación al rol del Estado, en relación a las políticas públicas de salud, a las políticas públicas sociales y de economía en general, y un falso debate también del gasto público, no gasto público, ¿no? Falso en tanto los resultados son como muy claros, y si todos, y está muy bien, como también los compañeros decían recién, volver a citar todas las declaraciones y acuerdos mundiales que hacemos en relación a sostener el bienestar común, los derechos humanos y el respeto a las democracias. Digo esto porque nosotros entramos en un momento de nuevo gobierno en Argentina, en un momento de mucha deuda, de poco gasto público y de cierre del Ministerio de Salud. Entonces tuvimos como revertir algunas decisiones de esas con una fuerte inversión. Argentina está en cuarentena. Nosotros, en relación a la cantidad de casos y sobre todo algunas regiones. Ustedes saben que nosotros tenemos 24 jurisdicciones diferentes, provincias. Lo más complicado es la región metropolitana, y que estamos con un 70-72% de las camas de terapia y respiradores ocupados, tanto en el sistema privado como público, y volvimos a una fase anterior, ¿no? Entonces, en esta situación del virus mutante y tal, vamos como cambiando de fase. Hay una decisión en relación a saldar esta discusión de salud y economía. Hay una fuerte inversión del Estado argentino en relación al cuidado de las personas, que tiene que ver con el IFE, un ingreso universal que lo están cobrando 8 millones de personas. Hay un recurso, los ATP, que son para empresas, se le está pagando a 2,5 millones de trabajadores el salario. Hay un nuevo plan alimentario, hay 11 millones de personas recibiendo tarjeta alimentaria. Una catástrofe, digamos, porque lo que pasa con la pandemia es esto que decía el compañero anterior, en relación a poner las desigualdades arriba de la mesa. O sea, por supuesto que tenemos desigualdades en relación al acceso a la tecnología, porque las clases son virtuales y hay gente que nos queda fuera, pero tenemos serios problemas con la alimentación, el acceso a cosas muy, muy básicas, y nos vuelven a hacer los sectores populares, y los jóvenes y los niños de sectores populares vuelven a quedar en un nivel de precarización y expuestos, así como las mujeres en general y las mujeres de sectores populares, y por supuesto las diversidades sexuales. En ese sentido, nosotros estamos atendiendo desde nuestra red 50.000 personas remotamente, 4.000 haciendo cuarentena en espacios o comunitarios o residenciales. Hemos tenido que aumentar, por supuesto, la cuota. Estamos trabajando en algo que tiene que ver con salir de la pandemia, cómo acompañar en relación a una lógica de economía de cuidado esa persona que va saliendo de un tratamiento. Digo, como cuestiones que tienen que ver con el rol del Estado y con imaginar cómo se cuida la población. Hay dos cosas que me parecen importantes para resaltar en términos de oportunidad o de campo fértil que nos va quedando a nosotros. Una es la lógica del cuidado colectivo. Nosotros instalamos mucho la lógica de que quédate en casa para cuidarte, si vos no te cuidas, no cuidas al otro, ¿no? Eso se instaló. Y la verdad que si lo hubiéramos planificado, digo, siempre yo, no nos sale, porque es una estrategia para trabajar específicamente desde Cedronar, el cuidado, el no estar solo y tal, pero se instaló eso. Y para nosotros eso es un campo muy importante en relación al bien común. No estaba antes de la pandemia esto instalado en Argentina. Así que eso me parece como muy importante. Y lo otro es algo que se instala con el consumo, las preguntas de, ¿está bien si yo, incluso los mismos periodistas preocupados, ¿está bien si abro el vino a las 5 de la tarde? ¿No? Como por el exceso de consumo en pandemia. Lo que también es una oportunidad para nosotros es que deja de estigmatizarse como si fuera un tema de un sector solamente de la población el consumo, sino como una problemática que nos afecta como a todos. En relación a eso también empezamos a hacer campañas masivas, entendiendo esta lógica de pregunta, en relación a preguntarnos qué pasa con el tiempo. Es un gran momento también para poder imaginar qué pasa con el tiempo y no llenar todo lo que pasa en la vida con consumos. Nosotros le estamos indagando y haciendo propuestas de interpelación a prácticas de consumo en relación a este tema, a las personas con los objetos, y nos parece que es un tiempo que nos permite como trabajar en eso y menos focalizado en un solo sector. Entonces, por un lado hay una gran estrategia masiva de cuidado, específicamente con el tema consumo. Nosotros venimos trabajando muy articuladamente con el Ministerio de Seguridad, entendiendo siempre que una cosa es una persona que consume y otra cosa es un delincuente y una red de narcotráfico, sobre todo los más débiles de la cadena, que son reemplazables para el narcotráfico y nos quedan expuestos, así que estamos trabajando mucho en estrategias de ese cuidado. Entonces, hay algo de poder ver al consumo en el marco de la pandemia como algo para interpelarnos todos por este tema. Entonces hay estrategias específicas para quienes venían teniendo un consumo problemático, y nos parece que es un momento para ponernos a preguntar cómo cuidarnos mejor en relación a los consumos en general, además de los consumos de sustancias. Creo que estoy justita con el tiempo.
Secretaria, muchísimas gracias. Y bueno, como dicen, el vaso se puede ver mitad lleno o mitad vacío. Y me alegra y recibo con satisfacción realmente, como supongo que el resto de los que están participando en este debate, ese análisis sobre oportunidades. Yo creo que efectivamente la distinción que hace la secretaria clara entre salud y economía al comienzo, y el hecho de poner sobre la mesa el tema de las desigualdades, junto con la observación genérica del análisis de las vulnerabilidades, incluido sobre todo la mujer, y bueno, toda la referencia al cuidado colectivo que hizo, que creo que es importante, como también el tema del estigma, pero todo visto desde un punto de vista de la oportunidad, ¿no? Realmente de ver esto como una oportunidad para revisar las estrategias sobre consumo, etcétera. Gracias, secretaria, por la presentación. Le paso la palabra a mi compañera Elena.
Yes, now we have time for some questions. So I would like to ask my first question to Mr. Jonasson, please. So Mr. Jonasson, which were the greatest innovations or innovative responses you observed as a reaction to austerity measures in your country?
I would be hesitant to use the word innovation, because we were in fact not doing anything new, I don't think. But what was out of the ordinary was our emphasis on vulnerable groups. I mentioned child abuse, violence in the home, etc., such like. This is what was out of the ordinary after we discovered something societies, of course, have sometimes discovered during the course of history, that the important thing is to have a cohesive society. And we sometimes tend to think that in times of crisis, or we take it as given, that during times of crisis, discrimination is on the rise, and this does not necessarily, and prejudice is on the rise, but this does not necessarily have to be like that. Because if society sees itself as being a society, being at one, it is more willing, I believe, to see social ills which it didn't see before. So crisis can in fact be an eye-opener, and that should be our task, our task who govern the countries or are giving advice to governments of countries, to try to create a cohesive society and become eye-openers.
Una pregunta, gracias, muchísimas gracias. Una pregunta para la secretaria ejecutiva, Gabriela Torres. Ya mencionó algo en sus palabras introductorias, pero me gustaría pedirle, por favor, si como persona que dirige tan prestigiosa institución como Cedronar, ¿cuál ha sido su primera respuesta ante esta situación? En otras palabras, pues, ¿cuáles han sido las primeras acciones tomadas para garantizar el bienestar de las personas con uso problemático de las drogas? Por favor, secretaria.
Bueno, lo primero fue, en relación al 20 de marzo hubo un decreto presidencial en relación a cuarentena, así que fue adaptar unos protocolos en relación a nuestros centros con internación, centros comunitarios con internación y centros comunitarios ambulatorios. Entonces, ahí rápidamente sacamos recomendaciones en relación a la no visita y facilitar el contacto con los familiares, el cuidado de la limpieza, el no mezclar trabajadores por turnos por si salían, digamos, bueno, un montón de cosas que fueron como protocolos rápidos de cuidado. El otro tema fue reforzar una línea que tenemos 141, que es 24 horas, reforzar no solo la atención, sino como una segunda malla de contención de trabajadores que no podían ir a la oficina, pero sí con líneas desde su casa, para que esa persona pueda llamar y ser llamada todos los días si es necesario. Abrimos como esa situación. Y lo tercero es que estamos trabajando con todas las provincias en una investigación, porque hay muchas encuestas que circulan en Argentina de universidades y tal, pero son más bien de tendencia, porque son hechas voluntariamente, por internet, con método bola de nieve y tal, pero no hablan exactamente de qué pasó con el consumo. Así que ahí estamos trabajando, esperemos tener la mitad de agosto, que por supuesto compartiremos. Estamos trabajando con 7 universidades en relación a las regiones del país, y cada provincia 2 ejes. Uno en relación a cómo tuvimos que modificar nuestra atención, nuestros dispositivos, cómo se modificó eso, y lo otro es qué pasa con el consumo, cuánto creció. Verdaderamente, porque si no hay un montón de supuestos que no, que como digo yo, hay como una fuerte percepción del crecimiento de consumo, pero no tan claro ni por región ni modalidades y tal. Así que rápidamente como trabajando en esta línea, y después a medida que el virus evoluciona. Nosotros la semana pasada tuvimos que vaciar un par de lugares nuestros, y tenemos gente en hospital y gente en hoteles aislada y tal, entonces hubo que hacer un nuevo protocolo. ¿Cómo es el tratamiento cuando el paciente está en un hospital? ¿Cómo se sigue? ¿Cómo se interna en cuarentena? Como los 15 días de cuarentena con tratamiento. Cada fase del virus, la verdad que nos hace generar un nuevo protocolo y un nuevo desafío de socializarlo y acompañar a todos los que están poniendo el cuerpo. Eso.
Muchísimas gracias, secretaria. Gracias por estar, a ambos ustedes, por estar dentro del tiempo dado. Pasamos al segundo panel, que como ocurre en el primero, tenemos a panelistas del primer orden. En este panel vamos a hablar del impacto en las políticas de drogas, y para ello tenemos, como mencionaba, a 2 panelistas extraordinarios. Empezó presentando al primero de ellos, Luis Alfonso Bello, doctor médico psiquiatra, asesor regional de abuso de sustancias en la Organización Panamericana de la Salud, con amplísima experiencia tanto a nivel clínico como de gestión a nivel regional. Estuvo durante varios años incluso en la CICAD, en la Comisión Interamericana para el Control del Abuso de Drogas, antes de que nos lo robaran desde la PAJO. Doctor Luis Alfonso, bienvenido, y el espacio es suyo. Por favor, tome la palabra. Gracias. Tiene que quitar el micrófono. El micrófono está desconectado, por favor.
¿Está desconectado?
Gracias.
Ok. ¿Ahora sí? Ok.
Sí,
muy buenos días. Decía que quería agradecer en primer lugar a la CICAD-UE, al embajador Nam, a Ángela, Claudia, a Jimena Kalowski, y particularmente a la sección de fortalecimiento institucional y a su jefe Antonio Lomba, a quien me une una larga historia de trabajo conjunto y amistad, por esta invitación y a la oportunidad de compartir este espacio con tan destacados panelistas de ambos lados del Atlántico. Es para la Organización Panamericana de la Salud, la Agencia de Cooperación del Sistema Interamericano, una muy valiosa oportunidad de fortalecer este compromiso en el impulso de la dimensión de salud pública en el complejo problema de la droga. Ahora, para nadie es un secreto que las condiciones socioeconómicas están fuertemente asociadas al uso problemático de drogas. Al igual que ocurre con el mercado de muchas mercancías, quien tiene más poder adquisitivo tiene una mayor capacidad de consumo, y eso es lo que ocurre. Entonces los países más ricos, los que tienen más dinero, son los que reportan el mayor nivel de consumo. Sin embargo, son los países más pobres, los países de mediano y bajo ingreso, quienes reportan una mayor acumulación de las consecuencias negativas del consumo. Es decir, esto que llamamos la carga de enfermedad, que es la concentración de la mortalidad prematura y la discapacidad resultante del uso de sustancias, se muestra desproporcionalmente concentrada en estas poblaciones. Y esto como consecuencia de una combinación de factores de pobreza y marginalidad, de determinantes sociales, entre las que destacan problemas de vivienda, alimentación, educación, de seguridad, pero ya aquí nos vamos aproximando un poco más al tema, al acceso y la calidad de los servicios de salud, tanto para la promoción, prevención, detección temprana, tratamiento, rehabilitación, integración social. Esta desventaja, esta inequidad se expresa no solamente en el ámbito de país o regiones, también en el ámbito individual y familiar y comunitario. Siendo las Américas la región más desigual del mundo, este es un tema de enorme preocupación para la agenda de política de salud de los países. En las condiciones actuales de la pandemia, cuyo impacto económico ha sido ya suficientemente expresado por los compañeros que me anteceden, la restricción de movilidad, de la actividad económica, está teniendo consecuencias gravísimas sobre la salud mundial. En el caso de los trastornos relacionados con el uso de sustancias psicoactivas, incluso es posible que algunos consumos se hayan reducido drásticamente, lo cual en principio nos pudiera parecer una buena noticia. Pero eso lleva de la mano también el incremento de los trastornos por abstinencia y el cambio hacia sustitutos que son de cierta medida una especie como de ruleta rusa, de sustancias producidas de manera ilícita o fármacos que son desviados para fines de abuso. Esto todo incrementa el riesgo de complicaciones, de infecciones, de sobredosis. Entonces, tenemos que el derecho al disfrute de la salud, un derecho fundamental, se está viendo seriamente comprometido tanto por la reducción de la accesibilidad y del aseguramiento de calidad de los servicios de tratamiento, ya sea por el cierre o por restricciones en el funcionamiento, falta de esos insumos básicos, alimentos, vestimenta, medicinas, equipos de protección contra infecciones, como resultado de la merma en la producción en el comercio, pero también por las medidas de confinamiento para prevenir la expansión del contagio. Entonces hay toda una distorsión del mercado que se expresa en una mayor situación de riesgo para los usuarios de sustancias psicoactivas y su salud. Esta situación, al igual que señalábamos en un principio, golpea de manera sensible a las poblaciones que ya se encontraban afectadas y que estaban en una situación de mayor desventaja. Toda esa concentración de determinantes sociales negativos y, por supuesto, su efecto en la relación con el consumo problemático de sustancias. Observamos entre algunos elementos que nos llaman la atención la promoción del uso de sustancias psicoactivas como paliativo de la ansiedad generada por la situación de pandemia. Tenemos entonces ofertas de mecanismos alternos de comercialización, ventas por internet, servicios de entrega a domicilio, además de la información tendenciosa que atribuye efectos benéficos de estas sustancias contra el virus. Tenemos algunos ejemplos en caso de la supuesta efecto benéfico del tabaco como protector, o del alcohol consumido por vía oral como una especie de mecanismo para acabar con el virus. Igualmente, aunque no está directamente vinculado con la sustancia, pero que está dentro del mismo espectro en el ámbito de salud, es el uso excesivo de dispositivos electrónicos de diversión y sistemas de apuestas por internet, que incrementa una serie de conductas adictivas también, y que todo lo cual configura un escenario de alto riesgo para problemas de abuso y dependencias, con y sin sustancia. Tradicionalmente, los presupuestos que se asignan para los temas de salud mental y uso de sustancias son deficitarios. Esto se agrava, digamos, en situaciones de crisis económica. Hay ejemplos de crisis económicas anteriores, pero tememos que también el desbalance que todavía se mantiene entre lo que se invierte en políticas de reducción de oferta y políticas de reducción de demanda, en desmedro de lo que se asigna para la reducción de la demanda, pueda acentuarse en esta situación de crisis económica. De allí que sea necesario trascender al sector salud. Es imprescindible la acción intersectorial para fortalecer esta dimensión de salud en las políticas para el abordaje de la problemática de droga. Digamos que esto, en estas condiciones de la pandemia, ha puesto en riesgo el logro de las metas globales de desarrollo sostenible que se establecieron en la Agenda 2030, no solamente el punto de la meta 3.5, que es la que se refiere específicamente a la prevención y el tratamiento para los trastornos por uso de alcohol y otras sustancias psicoactivas, pero también de otras metas relacionadas. Entonces tenemos por allí que en la región de las Américas, la Organización Panamericana de la Salud está trabajando intensamente en la implementación de las orientaciones que ya se han establecido de manera global por la Organización Mundial de la Salud, a través de la definición de un plan de acción de apoyo psicosocial en salud mental, el cual incluye un importante componente relativo a los problemas por uso de sustancias. Es en esta línea que venimos coordinando acciones con la CICAD-OEA, también con la sociedad civil en una agenda de trabajo conjunto que hemos establecido para responder a esta situación inédita. Entonces, ya concluyendo, digamos que el escenario actual y futuro es muy complejo y que va a requerir del fortalecimiento de estos lazos de cooperación entre los diferentes actores que están comprometidos con la reducción del impacto del uso de sustancias en la población mundial y particularmente en nuestra región. Gracias.
Muchas gracias, doctor Luis Alfonso. Magnífico análisis, creo yo. Gracias por, pues subrayaría brevemente, por no repetir la intervención, obviamente, pero creo que es muy importante, que el énfasis que ha hecho, como también los dos panelistas anteriores, sobre el tema de la desigualdad que se evidencia más en este momento que en otros, la necesidad de una acción institucional ante la situación actual. Creo que es importante, y gracias por el detalle de algunas de las complicaciones que se presentan en estos momentos, y sobre todo yo si algo destacaría realmente es el tema de la dificultad del acceso a los servicios de salud, y cómo eso compromete el disfrute y el derecho a la salud, que es absolutamente importante, sobre todo en la comparación que hace con otras crisis anteriores, ¿no? Y todos los temas que evidentemente pone sobre la mesa para discusión, el tema de la inversión pública, etcétera. Muchísimas gracias, doctor Luis Alfonso. Le paso la palabra a mi compañera Elena. Gracias.
So from Europe, we have the presence of Mr. Gerasimus Papanastasatos, a senior advisor to the National Drug Policy Coordination in Greece. Gerasimus is member of Advisory Board of National Drug Coordinator and National Committee on Drug Policy in Greece. As I mentioned earlier, Greece lived through difficult times in the past with important austerity measures during previous crises. And we thought it would be important that you share with us the experiences you lived through and all the consequences of these austerity measures and how can we apply these experiences to the present situation. So Gerasimus, the floor is yours, please.
Thank you very much, Elena. I had to share with you, it is a pleasure and an honor to share with you this webinar and to change with you some thoughts about what was the Greek experience. Even though, as Dr. Jonasson before mentioned about the Athens Declaration of the Bobidu Group here in Athens, was a first alarm in the direction of how drug policy could be influenced by austerity, economic austerity, or turnovers in the budget cuts on public health in general, and especially in the drug policy field. The main problem, if I had some time to make a come back on the first year of austerity in Greece, the 12 and 13 was a big stress, a big anxiety for all the drug services network, the National Drug Services Network. But the main crisis was in the society in general. What happened in the drug issue was second consequence from what generally the society saw was developed there. What happened is that the first victim of economic crisis were the treatment services itself, with very hard cut to the personnel costs or the budget of drug policy, dedicated to drug policy. And the second was a big new social inequality based on the increasing of employment rates and the social isolation in practice. What happened in Greece in these 3-4 years, first years of the crisis for the austerity measures, was that it was a big increase of social fear and a big increase of social isolation and social exclusion. Why I refer to these things? Not because it's something not logic in the period of crisis, but because these are the main factors, as Jonathan before mentioned, and Luis Alonso Bello mentioned again, that these are the crucial factors, the very important motives for drug behavior changes. I mean, is a good motives, a good causes for more drug abuse or behavior that are involved with drug abuse or behaviors that are very close to drug abuse, like gambling or alcohol drinking. When we pass to a new, let's say, strategy in order to focus to the big problems of the vulnerabilities linked with the drug abuse, we saw that the problems merged were with some special groups, homeless people, and prison population. At the end, at the end of 2010 decade, we were in a new situation, better situation, in which we tried to build a strategy in order to find these three-dimension context, including as a logic model, the strategy goals based on cornerstone principles, addressing, first of all, stigma and social exclusion, and then address the consequences of previous austerity measures. I try to to not put in the discussion the COVID-19 crisis that was a big new organizational crisis with the embarrassment of the network, with a big embarrassment for the services network about how to deal with drug abuse needs and with the needs of drug abusers in respect of their contact with services, trying to put it in a second maybe moment. What I would like to focus in this period, and not only as a thing that happened in Greece only, but even as a lesson learned from how to produce, to build an effective strategy for addressing social exclusion and stigmatization, is to change even our language, to change even our contextual structure in order to face the stress, the anxiety, the social isolation, and deployment. Remember that all these terms are terms that we used in the period of COVID epidemic, giving some new context to some goals that we had achieved in the past. Remember that individual isolation, social distance, work distance were in the period of epidemic protective measures, protective strategy. And remember again that instead of social distance, we had to talk for physical distance. Social distance stigmatizes the other and stigmatizes more the vulnerable people. So I joined very much Johansson's intervention because he remembered us that the crucial, the fundamental remedium at crisis in every kind of crisis is social coercion and the investment on social welfare that includes public health and social, and the policy of drugs. I think that I conclude with this last phrase.
Thank you very much. Thank you very much, Gerasimos, for these wise conclusions. I really like the way you said that despite of all, yes, stigmatization is there, and we're also we're all responsible for this. So it's the language that we use, all of us, because we are part of the society. And new crises lead to new stigmatizations and new ways of calling things. And I like very much how you said that we should avoid saying social distance because it does sound very stigmatizing. So when we're really talking about physical distance in this crisis. So thank you very much for this very profound thought.
Y pasando, gracias Elena, pasando a las preguntas de este panel, me quería dirigir primero al doctor Luis Alfonso sobre un tema que mencionó en la presentación, sobre todo el tema de los servicios, de la disponibilidad de servicios y del obstáculo, el problema que supone actualmente el acceso a dichos servicios. Como profesional de la salud y con su experiencia internacional, ¿Cómo están resolviendo, según ustedes, los países ese problema del acceso a los servicios? Y si quiere, aunque sea subrayar brevemente, cuáles serían sus principales recomendaciones al respecto. Por favor, gracias.
Yo creo que la pandemia nos muestra lo que era la situación anterior, es decir, lo que está ocurriendo con el acceso a los servicios es lo que ocurría anteriormente cuando no había pandemia, es decir, de cada 10 personas que necesitan tratamiento en la región de América Latina, apenas uno o quizás dos pueden tener acceso al mismo. Y esto es mucho más grave en los sectores más vulnerables. Entonces, la pandemia lo que los pone sobre la mesa es nuevamente la desigualdad, la inequidad, y encontramos como, por ejemplo, se focaliza la identificación de población de riesgo en poblaciones que justificadamente lo son, pero también se excluye a otras que justificadamente también deberían serlo. El caso de los usuarios de sustancias psicoactivas, de las personas con trastornos mentales que están, digamos, residiendo en establecimientos de salud mental o las personas privadas de libertad. Entonces, quizás como recomendación, creo que es una oportunidad el aprovechar algunas declaraciones de personas altamente visibles, como el caso del secretario, el director de la Organización Mundial de la Salud, cuando habla de la importancia de tomar en consideración los aspectos de salud mental durante la pandemia. Creo que abre un espacio interesante. Ahora bien, es también importante resaltar que en los contextos de atención a usuarios de sustancias psicoactivas se deben seguir las mismas recomendaciones de protección y de prevención que se tienen en el resto de los sistemas de salud. O sea, lo que es evidente para uno debe ser evidente para otro. No hay ninguna justificación, como tampoco la hay para suspender, por ejemplo, las medidas de aseguramiento de calidad, de que se estén funcionando como deben funcionar los servicios. Y la inclusión de estos colectivos altamente invisibles dentro de las poblaciones de alto riesgo en las situaciones de pandemia. Sabemos que este tema sigue siendo un tema bastante periférico en el sector formal de la salud, aun cuando hay un posicionamiento político que dice que la mirada tiene que ser una mirada de salud pública. Creo que la alianza entre los diferentes sectores del sector salud, por ejemplo, con las comisiones de drogas y con el sector justicia, son fundamentales para apoyar el acceso universal de esta población a los servicios de salud que requieren. Gracias.
And I have a question for Gerasimus, please. Gerasimus, you were speaking about the experiences of Greece in the past economic crisis. Could you please tell us which were the most hard hit areas by budget cuts in the sphere of drug policy in your country?
Well, the main consequence the first years, 12, 13, 14, were the hard cut to the recruitment of services, of treatment services. Think that for the big organization, the treatment organization, Greece, from an annual budget of almost to 25 million euros, the cut were of more than 10 to 12 millions for the two bigger organizations in Greece, more than 40-45%. These bring the consequence of cut of personnel, of the staff, and probably the effectiveness of the network, service network in general. But in terms of social reaction, I mean, of how the vulnerable people who need treatment, the most important thing was uh, the decrease of availability, of accessibility to treatment in these years. This was a first consequence in the street with new psychoactive substances and a kind of behavior change for more risky behaviors in respect of used drugs. Remember that in this period, in parallel, we had an explosion of HIV/AIDS infection in Greece that was in parallel, probably because of the combination of all these consequences. I mean, the weakness of treatment services from the one part and the new psychoactive substances for the other, and then the social circumstances that were worst. So, pass to pass from 14, 15, 16, this situation is changed. But even now, we are faced serious problems on how to rebuild feasible strategy with new operational goals. The strange thing is that reflections on this last crisis, I mean the COVID-19, so that services network responded with a with new answers and fast, focused to homeless people and to these that were more vulnerable, those that they were in the streets. I hope that we remember the lessons that we learned not easily all this decade in the future period.
Thank you so much for both panelists. Thank you for your responses. I'm going to pass to the next panel, the last one on the agenda. In this one, we're going to be discussing the need policies responses. And for that, we have, I believe, absolutely two excellent panelists. The two of them have been in charge of the National Drug Commission, Council, and agencies for many, many years. So they've been through not this crisis alone, but several in the past. So I know they can contribute a lot with their comments. Both of them are very well known and very good allies in many ways. I appreciate that they're here. I will start just introducing the first of the panelists, Mr. Michael Tucker, Executive Director of the National Council on Drug Abuse, NCDA of Jamaica. Mr. Michael Tucker, thank you so much for being with us, and the floor is yours, please.
Okay, thank you so much, Antonio. Could you put out the first slide, please? Okay, good morning and good afternoon, colleagues. I want to thank CCAD and the Pompidou Group for the opportunity to share our National Drug Council's response and recommendations regarding the COVID-19 pandemic. Jamaica and the wider Caribbean continue to be grateful for the ongoing partnerships and engagement with CCAD and other agents in these difficult times. We also wish to especially thank the Pompidou Group for including Jamaica in recent initiatives look forward to continued partnership. Next slide. Jamaica's first case of COVID-19 reached us in March 2020. Currently, we have 809 cases, 706 of which have recovered. We have only had 10 deaths. And this gives credence to the government's control measures to prevent the spread of COVID-19 and the public health response. The COVID-19 pandemic has resulted in significant changes and disruption to life as we know it. Jamaica and the wider Caribbean has recognized the need for swift action to protect our populations and public health systems. At the institutional level, the National Council on Drug Abuse recognized very early that the pandemic required a comprehensive plan to incorporate the change in the ways we deliver demand reduction services, engage the public to raise awareness about the possible impact of substance use on adverse COVID outcomes, especially when we talk about chronic smoking, vaping, and alcohol use, and seizing opportunities to create innovative and meaningful partnerships. So the three main areas of institutional response I wish to share are internal changes to address COVID-19, the way we did public engagement, and innovations to create and sustain demand reduction programs. Next slide. Since we determined the type of operational changes within the COVID environment, we looked at which staff members were at increased risk, what safety protocols needed to be in place, and what capacity building was needed to adjust to the current reality. Early in the pandemic, we perused and tailored the Occupational Safety Health Administration's guidelines on preparing workplaces for COVID-19 and tailored it to our own setting. We put safety protocols in place, so all face-to-face counseling was transferred to telecounseling. In addition, our harm reduction team working with homeless population received personal protection equipment and had strict sanitization regimes. We also established a month of internal staff training programs to build capacity in telecounseling, customer service, screening, brief intervention and referrals to treatment, conflict resolution, stress management, case management, and leadership, as well as a host of international webinars which were documented. This was a formal training program to elicit staff participation and assist in adjustment to the new normal. Beyond that, we provided formal COVID updates in keeping with the ongoing Government of Jamaica measures and made changes to institutional protocols as needed. Staff care was also an important issue as we are all impacted by this pandemic. So we have to purposely deal with the issues such as fear, loneliness, grief, and a number of circumstances made worse by the pandemic. Ladies and gentlemen, staff care is paramount in these times. Next slide, please. Keeping the public informed is crucial. We developed a number of publications, both in traditional social media, which sought to inform general public about the dangers of COVID and substance use, highlighted likelihood of increased substance use in the face of stress, and that the National Council on Drug Abuse was here to support interventions for persons with problematic use. We realized that people are isolated, some lost their jobs, and children are still out of school. Everybody was having a very rough time. We already had a helpline and had seen increased calls over the past few months as a direct result of the COVID-19 situation. And the PSAs we had placed encouraged people to seek help from us. Tracking this information is important to be able to measure the changes in help-seeking behavior over time. Next slide, please. We're all forced to do things differently. Stopping our programming due to school closure and social distances, we recognize some innovations that could be adopted to sustain and transform both prevention and treatment initiatives. National Council on Drug Abuse, through support from the International Narcotics and Law Enforcement Department of the U.S. Embassy, embarked on the digitization and animation of prevention program material to deliver on local platforms to reach our school children. We also piloted a drug prevention game called Smokescreen in partnership with Yale University, which targets refusal skill building against smoking tobacco among 11 to 16-year-olds. These are some of the opportunities we explored as institutional responses. Ladies and gentlemen, we are unlikely to return to normal anytime soon. So the sooner we make these changes, the better off our target populations will be. Next slide, please. Building and strengthening partnerships or capacity building is also an opportunity that can be seized. We have undertaken online training of the screening, brief intervention, referral to treatment approach among 300 Ministry of Education professionals, which included guidance counselors, deans of discipline and health and family life education teachers, to strengthen their response to students' substance use. Similarly, 130 healthcare workers in our only mental health hospital, Bellevue, as well as some of our staff from National Council, are currently being trained in use of a variety of treatment modalities to respond to dually diagnosed patients. So they were exposed to things like cognitive behavior therapy and trauma-informed care. This is another international narcotics and law enforcement supported initiative. Next slide, please. This slide just shows some of the projects that we have had to revise the timelines because of the COVID-19 situation. Next slide, please. So in closing, we wish to thank you for the opportunity to share Jamaica's experience. I encourage our Caribbean neighbors and others to determine first their contextual needs, put relevant systems and protocols in place. You need to keep the public informed. You need to recognize the possible increased need for high-risk groups, and we need to seize opportunities for change. And ladies and gentlemen, we need to be innovative in this COVID environment. Our population needs sustained demand reduction initiatives, especially in these times. Thank you very much.
Well, thank you very much, Mr. Tucker. Thank you for giving such a great detailed list of things that you're doing in Jamaica. As you said, it's time to do things different. And definitely, I mean, we all see the telecounseling that we are all having in many ways in our own lives right now under this situation, and people just were not used to this, and so you need to train people to do this online, and that is something that I'd like to highlight from your presentation. Thank you for going back to the very beginning to the risk analysis, which is something absolutely essential, and the screening portion of the whole structure of the protocol that you had in Jamaica. Definitely, the staff training, the staff care, the engagement with the staff, and also the whole thing of having the public informed and public awareness and all that activities that you are doing from Jamaica, the importance of outreach at the end of the day, and faced with people that are facing isolated situations with all the consequences of that under this rough time. Thank you, Michael Tucker, for this wonderful presentation. I let the floor to my colleague Elena. Thank you.
From Europe, we have the pleasure of welcoming Mr. João Bulau from Portugal. João Bulau is National Drug Coordinator and the Director General of the Interventions on Addictive Behaviors and Dependencies General Directorate, CICAD with S. Mr. Bulau has a very long experience in addictions field at national and international level. Since 2019, he is also the chair of the Pompidou Group of the Council of Europe for this work program period till 2020. So, and of course, it's important also to notice that Mr. Bulau is also a medical doctor by profession. Mr. Bulau, the floor is yours.
Hola. Buenas tardes, señor. Hola. Desde CICAD, con S. Un abrazo a todos. Es un placer ver tantos amigos aquí. y poder compartir nuestras experiencias. Mucho de lo que deseaba decir ha sido dicho. Compartimos las mismas dificultades, los mismos retos, y ha sido muy importante el rol del Grupo Pompidou y también del Observatorio Europeo de Drogas y Drogodependencia en hacernos compartir las dificultades y las respuestas que hemos podido instalar en el terreno. Hay algunos desafíos que hemos enfrentado también, como ha sido dicho por Gerásimos, por ejemplo, o señor Jonathan, de la crisis anterior, con la cual habíamos aprendido algo. Y en mi país puedo compartir que, aunque hemos tenido problemas muy serios con la austeridad que ha sido determinada por la intervención de la Troika en nuestro país, de todas maneras, en el Ministerio de Salud, en el gobierno en general, se ha percibido muy pronto que recortar en el presupuesto de servicios destinados a las poblaciones más vulnerables era un riesgo enorme. Lo aprendimos y mientras en otros servicios de salud, por ejemplo, en el 2009, 2010, 2011, hubo recortes hasta los 40%. En los servicios dedicados a las adiciones, hemos tenido recortes de alrededor de 10%. Claro que hemos tenido que sacrificar algunas respuestas, hemos tenido que sacrificar algunos estudios que son indispensables para mejor conocer la realidad sobre la cual actuamos, pero el esencial de los servicios lo hemos podido continuar. Y ahora, durante esta crisis pandémica que todos enfrentamos, debo compartir con vosotros que desde el primer momento, el inicio de marzo, la ministra de Salud y los secretarios de Estado, todas las mañanas realizan un briefing con los dirigentes de los servicios centrales, de los hospitales de emergencia, del laboratorio del Estado, de la Dirección General de Salud, que define la estrategia para enfrentar la pandemia. Y desde muy pronto yo fui invitado por la ministra a compartir, a participar en estos briefings, representando las poblaciones vulnerables. Y entonces, poblaciones vulnerables no solamente las que mejor conozco, las de usuarias de sustancias o con comportamientos adictivos de otro tipo, sino también las poblaciones sin hogar, los migrantes, y articular con otros ministerios políticas destinadas a esses grupos. Como decía el señor Johansson, el énfasis en las cuestiones de vulnerabilidad es fundamental en este periodo. Y aquí lo hemos logrado y hemos tenido siempre presente el desarrollo de medidas destinadas específicamente a esos grupos. Por ello, hemos enfrentado algunos problemas. Por ejemplo, una de las decisiones que ha sido tomada por el gobierno ha sido de libertar algunos millares de prisioneros. Y lo hecho es que, en realidad, algunos no han sido libertados de prisión, han sido expulsos de prisión. Y no se había preparado lo que hacer con ellos. Algunos de ellos con problemas de adicciones, algunos de ellos sometidos a programas de sustitución opiácea sin que se haya hecho previamente la articulación con los servicios que hacen el provimiento de esos programas. Entonces, súbitamente, una población muy numerosa pedía ayuda a los servicios que estaban con su capacidad reducida en esos tiempos. De todas maneras, gostaria de enfatizar el rol fundamental que los municipios han tenido en este periodo. Los que están más próximos de las poblaciones han hecho de una manera exemplar la coordinación de servicios, de ONGs que participan en el trabajo con estos grupos de una forma que ha sido muy, muy eficaz. Ha sido posible encontrar respuestas para grupos invisibles hasta entonces. Los grupos que se han quedado en la calle cuando todo el resto de la población estaba en confinamiento. Encontrábamos personas como migrantes, algunos de ellos indocumentados. Pues el gobierno portugués ha producido una legislación que equipara y que proporciona a todos esses migrantes exactamente los mismos derechos que a los nacionales. El derecho a todos los cuidados de salud, no solamente los relacionados con el COVID, pero a todos los cuidados de salud exactamente en las mismas condiciones de los nacionales. El secretario general de Naciones Unidas lo ha referido públicamente como un ejemplo y estamos muy orgullosos que haya sido posible desarrollar ese tipo de oferta. Poblaciones como las LGBTI que hasta entonces no tenían respuestas específicas y que súbitamente se notó el número importante, la importancia de los problemas que planteaban, también para ellos ha sido posible encontrar soluciones. Lo que tomamos de aquí con una mayor agilidad en los procesos de admisión en programas de sustitución opiáceos, la oportunidad de desarrollar respuestas inovadoras, a apertura de nuevos espacios de consumo asistido. En Lisboa teníamos en período experimental, hoy hay condiciones para abrir otro en el Porto, hay condiciones para abrir espacios inovadores para el manejo del síndrome de privación alcohólica, como sea la utilización de wet houses, una propuesta que ha sido siempre adiada, pero ahora lo estamos preparando para una apertura tan temprana cuanto posible. Hubo la oferta de otras respuestas que las ONG en el terreno estaban demandando hace tiempo, como sea los materiales para uso de sustancias fumadas, como el crack, las pipas, creo que se dice, y que hemos comprado y distribuido para llegar el más temprano posible al terreno. Oportunidades para desarrollar el drug checking, para saber exactamente lo que circula en el terreno, para saber cuáles son los verdaderos riesgos planteados por las sustancias que circulan en el mercado. En fin, de una manera general, yo podría decir que hemos aprovechado este período difícil para todos, para desarrollar nuevas respuestas y creo que va a ser posible porque hay una postura de gran atención a estas poblaciones por parte del gobierno portugués. Creo que va a ser posible darles continuidad. Y nos encantaría tener oportunidad de compartir más tarde lo que al final de esta crisis se queda de lo que ha surgido durante esta crisis, que es también una oportunidad. El secretario ejecutivo de MSUV ha mencionado un hecho que creo que merece toda la atención sobretudo para nós outros europeus, que é o hecho de que hoje mesmo ha sido aprovado um programa de financiamento para as economias da União Europeia. Creo que devíamos discutir entre nós outros como plantearnos para que a definição de los programas passíveis de financiamento por esse programa e dirigidos a las poblaciones vulnerables seja uma realidade. Hoje mesmo está sendo discutido no Parlamento português o plano de recuperação econômica do país. Tuve a oportunidade de ler um pouco em cruz esse documento muito extenso, pero me encantou ver uma atenção muito particular dedicada a populações vulneráveis, ao ênfase em emprego, uma discriminação positiva hacia o emprego para populações mais vulneráveis, e tenho uma sincera esperança que desde aqui seja possível desenvolver respostas dirigidas a estas populações de uma forma muito consistente, mesmo nestas situações de enorme dificuldade que todos vamos sentir. E, para já, é o que tinha para compartilhar com vosotros. Muchas gracias.
Thank you very much, João. Thank you very much for sharing your experiences. And indeed, a lot can be done on the policy level, and especially taking in considerations the lessons learned on the past experiences. As you said, that now it's clear that policymakers are aware that they're taking enormous risks if they cut budget on the services addressed to vulnerable groups. So this is something that now we know, and we should be really very attentive to it. And while you say that, yes, there is probably less money, economic possibilities, and that at the same time that some services has to be sacrificed, but the continuation of the essential services, this is what really is important in these difficult times.
Gracias, Elena. I'm going to go into English as the first question will be for Mr. Michael Tucker. Well, thank you for both panelists again. Let's go to some questions to both panelists, and I will start, as I said, with Mr. Tucker. Based on your experience, what will be, if you could highlight the three main strategies or actions that you recommend to governments ensuring essential services during the pandemic? I mean, you mentioned some of them already on your presentation. Is there any recommendation you would like to make, please?
Well, the government has to do a number of things. First of all, it has to engage the population and keep them informed about COVID-19. What are the dangers? What are the consequences that are faced if they don't really follow instructions? Keep them informed about how to keep themselves safe, and in turn families and friends and the population generally. They have to keep the healthcare workers safe and motivated in a very difficult time where they're actually asked to go that extra mile in an environment where they themselves may be exposed to infection from COVID-19, because we have heard in many cases and many countries where the healthcare workers, despite being there to save people and try to help cure them, they themselves succumb to the infection of COVID-19. And then to the supply of personal protection equipment for the healthcare workers, it's very important, especially in an environment where you have high volume of people coming in for care. Those three things. But what I think for Jamaica, because I mentioned only 809 infections in Jamaica, what the government did, which was very definitive was that immediately as there's a recognition that there was a crisis looming, they closed schools, they closed the borders, they closed all entertainment centers. In other words, they closed all those areas where you'd have significant congregation of people and people coming in from overseas that may infect the population here. And then they made a preparation in the public health system to accommodate and treat anybody who would present with COVID-19. So those responses were very definitive and very apt in ensuring that our infection rate was not very high.
Thank you so much, Michael. Elena, please.
Yes, Mr. Goulao, of course, as we were mentioning, during economic recession, there's naturally less available economic resources. So which, in your opinion, can be effective ways and means to temporarily reduce cost of services while ensuring quality and accessibility?
Ahora bien. Claro que hay que hacer, no, el dinero no estica, no da para todo. Y hay que hacer escojas. Creo que una forma de asegurar que el presupuesto no sufre tantos recortes cuanto sería la tentación es mostrar la eficacia del dispositivo que funciona en el terreno. Y hemos podido demostrar que con la intervención de los dispositivos de reducción de riesgos durante esta epidemia, durante esta pandemia, no temos tenido un número casi despreciable de infecciones entre las poblaciones de vulnerabilidad acrecida. Las medidas desarrolladas han sido eficaces y hay que mostrarlo, y lo hemos hecho. Al nivel de tratamiento, por ejemplo, nosotros tenemos una red de comunidades terapéuticas con cerca de 1.200 leitos, camas disponibles. Y hasta el momento, hasta ayer, no hemos tenido ningún caso de COVID positivo. 1.200 personas que se encuentran protegidas y que han sido mantenidas mismo si ocurre ahora, durante esta fase de confinamiento, ocurren contactos con las familias, no han sido identificados casos de positividad. Y eso es una demostración de competencia de los profesionales que hacen la gestión de estos servicios. Y ha sido posible demostrarlo a los responsables políticos. Yo creo que por ahí vamos a conseguir mantener los niveles de prestación de cuidados. Claro que en presencia de recortes hay algunas intervenciones que son siempre las sacrificadas. Por un lado, los estudios, las encuestas, que son de una manera general muy caras. Por otro lado, hay que aprovechar la experiencia que estos tiempos complicados nos han proporcionado y disminuir los costos involucrados en deslocaciones, meetings, desplazamientos de personas. Vamos a mantener la utilización de estos equipos que tenemos ahora para comunicar, para reunir, para discutir, evitando a veces desplazamientos de decenas de personas que tiene costos muy significativos dentro del país y para el exterior. Por lo tanto, los desplazamientos van a ser una de las áreas donde hay que poupar alguno de los medios disponibles. Por otro lado, hay que aprovechar los fondos que vienen de la Unión Europea y hay que discutirlo muy seriamente con países como la Grecia, por ejemplo, con los Erasmus. Tenemos que ver cómo hacerlo.
Y muchísimas gracias a ambos panelistas, a todos los panelistas en general. Pasamos al apartado, la siguiente parte de la agenda, y para ello le voy a pasar la palabra directamente a mi compañera, a Pamela. Por favor, Pamela, y muchas gracias de nuevo.
Thank you, Antonio, and thank you to all of our panelists for all of your wonderful presentations. We have reached the conclusion part of our webinar. Therefore, it is my pleasure to introduce Mr. Thomas Kato, Deputy Executive Secretary of the Drug Demand Reduction Unit of the Executive Secretariat of CICAD OAS. Mr. Kato, the floor is yours.
Unmute. Am I good? Okay, let's try again one more time. Already now we see that the situation of the pandemic undermines our efforts to increase the coverage of treatment and prevention services. Evidence is emerging that treatment and harm reduction services are seriously affected by budgetary constraints that are setting in. This means that we should prepare for an increase of HIV/AIDS and other communicable diseases among injecting drug use populations. We hear of budget cuts imposed on drug treatment programs in prisons. As a result, dependent prisoners start facing undue restrictions when in need of treatment. That means their right to access to adequate healthcare is in jeopardy, and this is a human right. Even where services are available, they may not anymore be accessible because of economic constraints. For example, the abolition of free transport for those people who use drugs and in need of treatment to reach facilities, treatment facilities, may prohibit access to this treatment. This may prohibit access to harm reduction and also to rehabilitation services. Overall, what we hear is that we are facing an increased risk that those in need will not seek the services because of reduced availability, difficulties in access, or because of fear of stigmatization. During such challenging times, it is crucial that states ensure essential services across the continuum of service provision. This will not only require increased cost effectiveness, but equally it will require working on all fronts for social cohesion and compassion in our societies. Economic crisis always comes with social and political crisis, as we hear and have experienced. However, the impact of the economic crisis is asymmetric. It often does not affect the whole country or all population groups equally, but specifically and always vulnerable groups. This is a chance for customized policy responses, targeting affected populations and population areas. This means that responses can be both predictable and more realistic, and thus more financially viable and feasible to implement. When faced to make choices between investment in more prison places as a response to an increase in drug-related crime as is in crisis situations, or retaining expenditure for drug treatment and social support, it should not be forgotten that the effectiveness of drug treatment outweighs by far the alleged benefits of incarceration. So, what should the immediate policy responses include? Firstly, the setting up of a national coordination framework for national drug policy measures and decision-making powers in times of acute crisis outbreaks in the drugs field, to allow for swift and concerted action. Secondly, agreement on needs-based prioritization for programs and activity that can be rapidly put in place to respond to mounting challenges. And last but not least, thirdly, the exploration of possible and feasible, innovative, or well, maybe existing but forgotten answers and approaches to optimize service provision and manageable costs. Thank you.
Thank you, Mr. Cato, for your remarks. Jimena, the floor is yours.
Sí, muchas gracias. ¿Se oye? Supongo que sí. Sí, perfecto. Bien, yo creo que ha sido muy iluminador el diálogo que hemos tenido hoy día al poder contrastar las experiencias de la región de las Américas con la experiencia de Europa. Tal como señalaba Luis Alfonso anteriormente, esto ha sacado a relucir situaciones que ya conocíamos en términos de la vulnerabilidad que tiene nuestra región por programas que todavía no tienen un buen sustento. A diferencia de Europa, todavía nos falta avanzar mucho en los sistemas de seguridad social y en las condiciones probablemente sanitarias básicas en muchos de nuestros países. Entonces viene esta crisis del coronavirus y expone las vulnerabilidades que ya tenemos. Creo que ha sido muy interesante el poder revisar las lecciones aprendidas en Europa de la crisis anterior. Concuerdo que es muy necesario contar con una comunidad, una sociedad que esté bien afianzada, bien cohesionada. Tuve el privilegio de visitar Islandia el año pasado en un programa con Pompidou Group también. Y bueno, logramos aprender muchísimas cosas de todo lo que se estaba implementando y del desarrollo que tenía Islandia como país. Hoy en día en nuestra región nosotros lo que estamos viendo es un resurgimiento de la pobreza y la miseria también, por lo cual es muy probable que muchos de los recursos, que son pocos, que puedan estar disponibles, vayan directamente a la atención de necesidades básicas de la población. Y en ese sentido es muy importante volver a poner de relieve que la población con la que nosotros trabajamos es una población especialmente vulnerable, más aún en este periodo del coronavirus, y poner los esfuerzos también en el tratamiento, en la prevención. Más que nada ahora debemos mostrar la evidencia y proponer políticas centradas en la evidencia, ya que justamente los recursos son menos, tenemos que focalizarnos donde sea mucho más costo efectivo el implementar los programas de reducción de la demanda de drogas. Solamente me gustaría terminar diciendo que en este momento es más relevante que nunca la cooperación y el intercambio de experiencias entre los países, como la que hemos tenido el día de hoy, aprender de las buenas prácticas. Nosotros, desde reducción de la demanda, en los primeros días de la pandemia, en el lado de acá del mundo, tomamos contacto, por ejemplo, con España para ver qué estaban haciendo, cómo estaban trabajando, que ya llevaban más días que nosotros con la pandemia y cómo estaban organizando los servicios. Entonces, más que nunca es muy necesario la cooperación entre los países y el apoyo técnico y el intercambio de buenas prácticas. Creo que es muy importante, haciendo eco también de esto del uso del lenguaje, creo que es muy importante mantener la esperanza, aunque pueda ser un escenario bastante duro y difícil. Yo creo que todos los que trabajamos en esta temática somos bastante resilientes y uno de los temas más importantes que tenemos que mantener la esperanza en un escenario incierto de que vamos a salir adelante y que unidos va a ser mucho mejor que desunidos y que nos vamos a poder apoyar mutuamente y que la distancia física no significa un distanciamiento social ni emocional. O sea, yo creo que reuniones como esta demuestran que emocionalmente y afectivamente seguimos estando juntos en este contexto de distanciamiento físico y que podemos ayudarnos solidariamente unos a otros a salir adelante. Creo que debemos fortalecer en nuestras políticas y en los escasos presupuestos que tengamos, fortalecer a los servicios de salud, a los programas de droga. Efectivamente, tenemos que hacer un trabajo muy importante con los migrantes porque al menos en nuestra región se ha visto que una tendencia de los migrantes a querer volver a sus países de origen, aun cuando las condiciones sean peores que en el país donde migraron, porque efectivamente el tema de los afectos es algo que tiene mucho peso cuando vivimos situaciones de crisis y de vulnerabilidad como la que estamos viviendo. Y poner sobre todo también la atención en los niños, porque también pueden estar en algún contexto más protegidos del consumo de sustancias, pero también cuando las familias tienen que salir a buscar el sustento básico, los niños quedan mucho más expuestos, más vulnerables y las familias pierden la noción de el rol de socialización que tienen en desmedro de tener que salir a buscar el sustento diario. Creo que el aprendizaje que hemos tenido hoy día de los distintos países, el intercambio de experiencias de expertos ha sido muy enriquecedor y bueno, y espero y confío en que seguiremos teniendo actividades como esta. Muchísimas gracias.
Excellent remarks, Jimena. Thank you so much for that. Finally, I would like to reintroduce Angela and Elena, who will be sharing with us some brief closing remarks. Therefore, Angela, the floor is yours.
Thank you, Pam. I would like to thank all those who have participated today. Thanks to our panelists and the expertise they brought to this event. I'd like to thank our CCAD member states participating from the Caribbean, from North, Central and South America, as well as civil society, international and regional organizations, and representation from Europe and around the globe. Thank you to our CCAD team, to Elizabeth, particularly Pam. Thank you, Pam, for guiding us. Thank you to Santiago for all the technical support behind the scenes, as well as my colleagues Antonio, Jimena as well, who bring their wealth of experience together with their passion for their programs. Thank you so much. Thank you to the interpreters as well. Lastly, but not least at all, I'd like to thank and recognize the Pompidou Group. Thank you to Executive Secretary Denis Hubert for coming on board on his holiday as well. Thank you to Elena, to Thomas. Always such a pleasure to work with you all. I invite and encourage everyone who is watching to join us for future webinars, to encourage you as well to contact us with any suggestions on topics you might have for future webinars. We welcome your valuable input as we continue to rebuild, reconstruct and adapt our policies and our programming in this ever-changing world. I wish you all good health. Thank you.
Thank you, Angela. Elena, the floor is yours.
Thank you, Pamela. Ladies and gentlemen, during this webinar, we were reminded once again about discrimination of people who use drugs in times of economic and financial crisis and the correlation with stigma and social exclusion. Political and social acceptance of addiction as a health condition, no different from other chronic diseases, can be severely undermined by social circumstances following budgetary cuts and austerity measures. Our human rights obligations require us to take precautions that will not happen again. The Pompidou Group stands for bringing human rights to the forefront of drug policies. Our current work program has the priority to reduce stigmatization. Together with Canada, we recently launched an initiative to support the CND resolution 6111, promoting non-stigmatizing attitudes. We are planning a symposium on this topic hopefully already before the end of this year. This event is planned to take place in Canada. This will not only follow up this webinar, but also be another opportunity to further advance our cooperation with CICAD. By joining forces, we will once again be able to bring key stakeholders from Europe and the Americas to a high-profile event happening face-to-face this time. And meanwhile, as Angela was saying, I would like to thank all of you for attending this joint webinar, and in the series of webinars that we would like to organize, because we're planning to have several. We welcome your ideas on topics of your concern, which you would be interested to hear the discussions from Americas and Europe. So please contact us and stay in touch. Thank you very much.
Thank you so much, Elena, and thank you for everybody that provided some wonderful closing remarks. I couldn't have said it better. Before we finalize, I would like to kindly invite all of our participants that are still viewing to answer the feedback evaluation that should be appearing in your screens right now as we speak. I will leave it active for the next 60 seconds. Your feedback is very important for us because, as Angela and Elena were mentioning, we hope to host many, many more webinars in the future and have top-notch panelists like we had today. So your feedback is really important. Also, if you would like to share with us some of your thoughts or additional observations, I kindly invite you to send us an email with your observations to the email that is indicated in the invitation that you received to enter this webinar. The email is pizaguirre@oas.org. It should be on your invitation. Happy to spell it out. P-I-Z as in zebra, A-G-U-I-R-R-E @oas.org. I will be glad to collect all of your observations and share them with all of my colleagues. With that, I declare the poll finalized. And with this, we conclude the webinar. On behalf of the Executive Secretariat of CICAD OAS and Pompidou Group, Council of Europe, we want to thank all of the panelists for their valuable contributions and everyone who has joined us today. Thank you very much, and until next time.